Hey guys, welcome back to the channel. Today we're going to be looking at the potential causes of bad breath, its origin, diagnosis and how to manage it. Bad breath or halitosis affects an estimated 25% of people. There are a number of possible causes of halitosis, but the vast majority come down to oral hygiene. It is also known as halitosis or fetor oris, can cause significant worry, embarrassment and anxiety, but it's relatively easy to remedy. So what is halitosis? Halitosis is synonymous with bad breath or fetor oris and is a common problem that can cause significant psychological distress. There are a number of potential causes and treatments available. Anyone can suffer from bad breath. It is estimated that 1 in 4 people have bad breath on a regular basis. Halitosis is the third most common reason that people seek dental care after tooth decay and gum disease. Simple home remedies and lifestyle changes can improve bad breath, such as improved dental hygiene and quitting smoking. So what are some of the treatments? The best method to reduce halitosis is good oral hygiene. This ensures that cavities are avoided and reduces the likelihood of gum disease. It is recommended that individuals visit the dentist for a checkup and scalp and polish twice a year. The dentist may also recommend a toothpaste that includes an antibacterial agent or an antibacterial mouthwash. Alternatively, if gum disease is present, professional hygiene treatment may be necessary to clear out the buildup of bacteria in pockets between the gums and teeth that can lead to bad breath. So what are some of the possible causes? Well, the potential cause of bad breath include tobacco. Tobacco products cause their own types of mouth odor. Additionally, they increase the chance of gum disease, which can also cause bad breath. Food. The breakdown of food particles stuck in the teeth can cause odors. Some foods such as onions and garlic can cause bad breath. After they are digested, their breakdown products are carried in the blood to the lungs where they can affect the breath as well. Dry mouth or xerostomia. Saliva naturally cleans the mouth. If the mouth is naturally dry or dry due to a specific disease such as odors can build up. Simple thing like dehydration that can lead to dry mouth can also lead to bad breath. Dental hygiene. Brushing and flossing ensure the removal of small particles of food that can build up and slowly break down, producing an odor. A film of bacteria called plaque builds up if brushing is not regular. This plaque can irritate the gums and cause inflammation between the teeth and gums called periodontitis. Dentures that are not cleaned regularly or properly maintained can also harbour bacteria that can cause halitosis. Crash diets, fasting, and low carbohydrate eating programs can produce halitosis. This is due to the breakdown of fats producing chemicals such as ketones. These ketones have quite a strong aroma. Drugs. Certain medication can reduce salivary flow and therefore increase odours. Other drugs can produce odours as they break down and release chemicals in the breath. Examples include nitrates, used to treat angina, some chemotherapy chemicals, and some tranquilizers, such as phenothiazines. Individuals who take vitamin supplements in large doses can also be prone to bad breath. Mouth, nose, and throat conditions can also lead to bad breath. Sometimes small amount of bacteria that can lead to tonsillar stones can form on the tonsils at the back of the throat, can produce a significant odor. Also, infections or inflammation in the nose, throat, or sinuses can cause halitosis. Foreign body. Bad breath can be caused if they have a foreign body lodged in their nasal cavity, particularly in children. Diseases such as cancer, liver failure, and other metabolic diseases can also cause halitosis due to specific mixes of chemicals that they produce. Gastroesophageal reflux can cause bad breath due to the regular reflux of stomach acids. There are also some rare causes of bad breath, and we know that common things are common, but other situations can also be accountable for bad breath. These include ketoacidosis. When the insulin level of a person with diabetes are very low, their bodies can no longer use sugar and begin to use fat stores instead. When fat is broken down, ketones are produced and build up. Ketones can be poisonous when found in large numbers and produce a distinctive and unpleasant breath odor. Ketoacidosis is a serious and potentially life-threatening condition. Bowel obstruction. Breath can smell like feces if there have been prolonged period of vomiting, especially if bowel obstruction is present. Bronchiectasis. This is a long-term condition in which the airways become wider than normal, allowing for a build-up of mucus that can also lead to bad breath. Aspiration pneumonia, a swelling or infection in the lungs or airways due to inhaling vomit, saliva, food, or liquids. So what are some of the symptoms that patients with halitosis can present with? Well, the specific odor of breath can be varied depending on the cause of the problem. So what are some of the remedies? Well, it's important to brush the teeth at least twice a day. Flossing reduces the buildup of food particles and plaque from between the teeth. Brushing only cleans around 60% of the surface of teeth. If you wear dentures, then make sure that the dentures are clean on a daily basis. Cleaning prevents the bacteria from building up and being transferred back into the mouth. Changing toothbrush every 2 to 3 months is also important for similar reasons. Brush the tongue. Bacteria, food and dead cells commonly build up on the dorsum surface of the tongue, especially in smokers or those with particularly dry mouth. A tongue scraper can sometimes be very useful. Try to avoid having a dry mouth, so drink plenty of water, keeping well hydrated. Avoid alcohol and tobacco, both of which can dehydrate the mouth. Chewing gum or sucking a sweet, preferably sugar-free, can help stimulate the production of saliva. If the mouth is chronically dry, you may require medication that stimulates the flow of saliva. Diet. Avoid certain types of foods such as onions, garlic, and spicy foods. Sugary foods are also linked to bad breath. Reduce coffee and alcohol consumption. Eat a breakfast that includes rough foods can help clean the back of the tongue. Well, we hope you found the video useful in identifying the possible causes of bad breath and how we can alleviate and treat these conditions. Well, thank you very much for listening. Please kindly like the video if you found it helpful, and we'll be bringing more videos for you in the near future. Thank you very much again. Bye.